called Walking Two Paths, which is about cultural resilience. And we're getting it started with this collaborative webinar between AHEC and IHEART, focusing on Native students in medical school and how cultural resilience plays into their experiences. So to save time, I'm going to put our panelists' bios in the chat that you can read rather than reading them out loud. And I'm going to pass it off to our moderator for today, Stephanie Dobos, and thank you very much.
Thanks, Eric. Very much appreciated. Wanted to say hello to everybody and thank you guys for being here, both webinar participants and our panelists. I know a lot of people have things to do at 2 p.m. on a Thursday, but we're glad you're here with us. Just a quick introduction. My name is Stephanie Dobos. I am the program manager for IHEART, not the music company, it's something else. IHEART stands for Indigenous Health, Education, and Resources Taskforce, and we are a collaborative group that is funded by the Robert Wood Johnson Foundation, and we are a collaborative body led by the Association of American Indian Physicians. That's where I'm technically housed. The American Indian Higher Education Consortium, the Association of Native American Medical Students, Association of American Medical Colleges, and of course, the Indian Health Service. What we're doing is we're aiming to foster Indigenous-led, culturally responsive networks that can advance systems change to try and enhance the engagement, matriculation, retention, and graduation of AIAN individuals interested in health professions. And that doesn't just mean necessarily medical school, but dentistry, nursing, veterinary medicine, runs the whole gamut of the One Health Collaborative. So all the way K through 12, up through graduate school, medical school, that's what we're doing. We're trying to help develop those regional networks and promote that systems level change. So with AHEC being part of that, we thought that this was a great opportunity to kind of cross promote, and it ticked a lot of boxes for both of us. About me personally, I'm based out of Raleigh, North Carolina. I did my undergraduate degree at Duke University, finished my master's in public health at UNC Chapel Hill, which if anybody is familiar with March Madness, which is going on right now, it creates a little bit of cognitive dissonance for me, but I'm trying. And I'm going to be moderating. We're going to start out today with just letting our four panelists introduce themselves quickly. Those bios, if they're not in the chat already, will be in there soon. We're just going to kind of have a really casual conversation about cultural resilience in medical school as an Indigenous person. So just to get us started off, why don't we go to Tatyana?
Hello, everyone. My name is Tatyana Dunn. I'm from North Carolina, and I'm currently a rising third year at Boston University Medical School in Boston. There's a much longer name, but Boston University is fine. Yeah, and I'm really excited to get to know you all today and have a great conversation.
Perfect. Thank you. And how about Ms. Shaelyn?
Hi everyone, I'm Shaelyn Hayes. I go by she, her. I was born and raised in Tulsa, Oklahoma, and I attend Oklahoma State College of Osteopathic Medicine at the Cherokee Nation. We're the second class out there at the Cherokee Nation in Tahlequah. And I'm a rising third year, or I am a third year, a rising fourth year. And I really want to do geriatrics when I'm older.
That's awesome. And Michael?
Halito. My name is Michael Shukis, proud member and citizen of Choctaw Nation, originally from Redding, California, far up north, and currently second year attending University of Cincinnati College of Medicine.
Great. And last but certainly not least, Morghan.
Hi, everybody. My name is Morghan Byrnes. I use she, her pronouns. I'm from Pipestone, Minnesota, but I also claim the Rosebud Sioux Tribal Nation in South Dakota as another home of mine. I attend the University of Minnesota Medical School, and I did my preclinical years and now my clinical years in Duluth at the Duluth campus. And I'm interested in pediatrics and psychiatry and perhaps combining the two and doing child and adolescent psych.
That's awesome. We have a really diverse group here with a lot of diverse experiences. So hopefully we're going to get a really nice breadth of information today. So the way we've kind of organized this, again, we're trying to keep it super casual. Our first question, and any panelist or all panelists are welcome to answer. How has your cultural identity shaped your journey through medical school? And in what ways, if any, do you incorporate your cultural background and the epithets of your personal ethos into your education and practice? Anybody's welcome.
I can start. I think I have a little bit of a special viewpoint out here at the Cherokee Nation. I'm part of the tribal medicine track out here, and most of my rotations are out there in Tahlequah, almost all of them actually. But my background is actually, I'm part of the Tlingit and Haida tribes, Indian tribes of Alaska. So I'm actually the AN part of AIAN. So that's very special to me. But every day, I mean, I think my cultural identity has really increased in medical school because of what I'm around, and just like I've been able to incorporate it into my everyday life. And I kind of, when I'm having patient experiences in medical school, I'm really able to connect with people more. And I think that having the background that I do have, it makes me be able to talk and kind of understand in the clinical situations, and then also like finding their motives of health advocacy and what they want for their health, I think is really important. And I'm able to connect through that through my cultural identity. So I think that's a pretty special part of patient interactions, especially as a medical student, and hopefully when I'm a physician.
Can go next. I think being Indigenous really informed just like the start of my path into medical school as well. Just seeing my family members try and traverse the Western medical facilities, I just felt like I could provide a safe space for not only just for Indigenous folks, but for other underrepresented people in medicine, just to feel free to be fully themselves at the doctor. And I've kind of been able to hopefully incorporate that into my clinical rotations. I feel like so often in westernized medical school, we're taught really about physical health. And one of my goals of third year has really been to ask people about spiritual health, emotional health, and mental health too. And making those a priority when I'm doing like a history and physical and that sort of thing. So that's kind of how I use my Indigenous culture to inform my current practice. And hopefully I'm able to expand on that as I go into residency and then my career as well.
Thank you. That's great.
So
You can go ahead, Michael.
So I have a slightly different background. So I've always been Choctaw, but growing up in California, my culture was never really like a large part of me, being so far away. And so it really wasn't until medical school and connecting with other Native students that I really started to reconnect with my culture. And I feel like it's been such a wonderful process, being able to reconnect with my people, connect with other Indigenous medical students. And I feel like I've really grown over the past 2 years that I've been in medical school. I've been able to reconnect in many ways, and I've grown, and I'm really hoping to take these practices and incorporate it third and fourth year. And I realize that as I do so, hopefully I can, not only change myself, but change the others around me.
So first off, something I forgot to say earlier as the first person to introduce myself, I am a member of the Halawa Saponi tribe in Hollister, North Carolina, and I'm interested in emergency medicine currently. But to answer the question, I think my experience is just a little bit different being in Boston. First year, I think I really struggled with cultural identity just because as of right now, as far as I know, I am the only Indigenous student at Boston University Medical School. So I kind of am by myself, and it was hard for me to find that community. And also like just being in the city, and I don't have my car up there yet because like no one drives in the city. So it was harder for me to go to cultural events that, other organizations may have held that were further away, or, and then school that's just so busy. So also as far as like patient population. Believe it or not, Boston's actually a majority minority city, but I have not ran into a lot of patient interactions with other people that are Indigenous. But I will say that in my free time over the summer, I made sure to come back home and volunteer in my rural health community center here with one of the doctors that are also in my tribe. So that's been a good experience for me. I think for me, it's just I've been having to more so seek out those experiences to include my culture in my journey, because I'm not like necessarily surrounded by it.
Thank you, everybody. It's really interesting to hear how many of you kind of got more in touch with your cultural roots as you were in medical school. And I'm making mental notes to myself about contacting you guys about things for iHeart going forward, because clearly you are definitely representative of what our mission is, which is super great. So thank you guys for that. So now we have a couple of more pointed questions that we're going to ask of individual people. They weren't planned in any sort of super specific way. So our first question, I know you just finished, but is for Tatyana. Have you experienced any challenges related to your cultural identity as you're pursuing your education? How did you overcome it? What kind of tips do you have for other Indigenous students who may be going through similar things? And because we are trying to stay assets focused, we also want to know about your triumphs and things that are going really well. You don't want to hear everything that's going bad all the time. So definitely what things are working and how are those kind of affecting your journey in medical school?
Yeah, so something similar that I just said, is that like in Boston, there are not a lot of Indigenous people at my school. I think I'm the only one, as far as I know. And so growing up as well, I did not see a lot of doctors or nurses or anything like that, or really a lot of people in healthcare in general that were Indigenous. I remember being so young, just to take it back for a second, I'm going to wrap it up, I promise. But I remember being young and looking at my older cousin, and she was at East Carolina University at the time. And she was like, I want to be a doctor. And I was like, oh my God, I want to be a doctor, but I'm like a kid. So she's probably looking at me like, I'm in the midst of it. I hope you make it. So since then she has graduated. She's a family medicine doctor now. And so I think the cultural identity portion of that was that I felt alone in Boston. And so something that was very important for me is to make sure that something that's near and dear to my heart is Indigenous health, and to make sure that I incorporated that somehow, some way. And so the summer in between my first and second year, I made sure that I wanted to come back home and do something for my community. And luckily for me, she was in the community working at a rural health group office as a family med doc. And I was able to come back and shadow her and speak with patients and interact with patients. And it kind of reminded me of my why. Because I will say a lot of times it gets very discouraging and it's really hard. We were laughing earlier before this, but I'm currently studying for my first board exam, and every day I feel like I can't see anything beyond 24 hours, let alone like seeing everyone, if you guys know what that is, like match day that just happened for a lot of fourth years. I'm like watching them crying, and I'm crying too because I'm like, oh my gosh, how will I ever get there? So I think the thing that helps me triumph is like having the community and reaching out. I'm a part of ANAM, so I think it's been a beautiful thing to see Indigenous students that are above me or at higher levels than me, and Indigenous doctors succeeding in what they're doing in their careers and just how they have overcome. I think it was a beautiful thing to see, someone comment in the group chat like, hey, me and some other ANAMS people matched EM and we matched at the same place. Like that was really, really motivational for me. So I think that's how I triumph. It's just kind of leaning back on my community anytime I feel like, oh my gosh, can I do this? I think I just reach out to um Jalika, which is my cousin, that's the doctor. She's like the only doctor that I know that is also in our tribe. And so, luckily she's my cousin as well. But, just reaching out to her and saying, like, hey, I need some advice. I definitely advocate, never isolate yourself. because I feel like that's what I did my first year. And if I didn't reach out, I don't know if I would have been able to continue. So, yeah.
Thank you. That was really great. Appreciate your candor, and that's going to be crucial when you're in as you go through medical school and get into practice. So I promise you, you will get there. Don't stress, you'll get there. Easy for me to say, right? So our next question I have down for Shaelyn. Have you had mentors or role models who have influenced your understanding of cultural resilience in the medical field? How did they impact your journey? And again, any advice for its aspiring Indigenous students looking to get culturally significant mentorship?
Yeah, so as I said, I'm out here in the Cherokee Nation. Dr. Natasha Bray is actually the dean of our medical school, and she's a Cherokee Nation citizen. But she's pretty much brilliant in every aspect of her life. She went to Harvard which is predominantly an MD program, as a DO. So she got her OMM certification, all those extra things. And Dr. Bray has really heavily impacted my journey. As an Albert Schweitzer Fellow, she was my academic mentor at school, and she's really able to provide personal experience. And I think that is a really huge thing, especially in our communities, that just being able to connect with people and understand where they're coming from, especially in a rural and tribal setting like we're in, especially rural, because there's just not as much out here. And just connecting people with the resources is especially, so my Albert Schweitzer project was over with kids with autism, parents of children with autism. So we're working with the parents mostly. And so out here, they don't really have, I mean, Cherokee Nation doesn't really even have a lot of resources for those kinds of people. So connecting them with PT outside of school and inside of school, those kinds of things was something that she was really able to help us with. But I think mentorship in general is just such a big thing. I didn't really have that a lot in medical or like in undergrad into medical school. And I think especially in the Native community that there's so many like communities, organizations, and groups that you can be a part of. Like ACES is like American Indians in Science and Engineering Society. And of course, she's talked about ANIMS. Native Florida is another one that I'm connected with. And Sarah came to Tahlequah. She's going through the US, and we got to speak with her a little bit. So I think just building relationships with Native faculty in those programs, and then also at the school, finding local mentorship is also really important. I feel like you have to be proactive. Like you can't just expect everyone to come to you. And I mean, you have to be persistent about things. And I think as a student, it's scary because you're like, they're in medical school, they're doctors. And I think it's even scary for medical students, honestly. It's scary for me to ask for a letter after a rotation. Like, it's just how it is. But I always think about it as they've been in my spot once before. So I have to tell myself those kinds of things, and that everyone understands what you're going through. And this is probably the only community that understands what you're going through, especially as a medical student. She said she was studying for step 1, and I'm like, oh my gosh, that was a year ago. That was me. Like, it's just immensely, I know how she feels like, and it's such a community, especially in medical schools. And I know it's just like that in vet school. I know someone that goes to OSU at the vet school. But I think finding your community is one of the biggest things, especially in medical school. If you're in grad school, wherever you are, finding like-minded people is really important, and that follow the same kind of values that you follow is super important. And you'll find those people. I think you'll find them eventually. I think it's funny. You think back to your first year in medical school, and you're like, how did I get these friends? Like, after one test one day, that person was smart. So I was like, oh, can you help me with anatomy? And now he's like one of my best friends, and it's just really funny. So a community, I think, is the most important part.
That's fantastic. I'm really glad that you have that resource, and that you were brave enough and willing to kind of approach other people and say, hey, this is what I'm thinking, this is what you're thinking, let's collab. That's fantastic. So our next question is for Michael. Do you feel like there's a deficit in medical schools in terms of cultural competency and humility as it kind of relates to Native Americans and healthcare? How can infrastructure better support the growth of cultural competency if it is lacking, and peer education, things like that? How do you foresee things going forward and improving?
So I first want to preface my answer that what I'm saying is based off of my own medical school. Every medical school is different, has their own programs, has their own system of doing things. But in general, yes, I do feel like there is a lot of work that needs to be done. So when I first came to University of Cincinnati, one of the first things I did actually was go to the Office of Diversity, Equity, Inclusion, just to see if they can connect me with anyone that's Indigenous, student or faculty member. And they just kind of looked at me with a blank stare. They had no idea where to start. They didn't already have these systems in place, and they weren't really able to help me with that. And so for the past 2 years, I've just been trying to find people, reach out to people, and then, hopefully build a community from the ground up. And it's not saying that like the ODI office was like, not welcoming. They were very warm, very welcoming. They wanted to help, but it's just, they didn't really know that we as students existed, that we were there at Cincinnati, and they just didn't know how to help. And so I feel like, even with me trying to reconnect with my heritage, it would really help to have mentors at Cincinnati, to have other people around me that can help guide me along this process. And I have found people. I found other faculty members over at the Children's Hospital, as well as faculty members over at the main campus of University of Cincinnati. And they've been incredible and helpful along this journey. But I feel like just ways institutions can hopefully improve in the future is just knowing who to reach out to in the first place, building up that connection of people. And I realize that, Ohio specifically, Cincinnati, it doesn't have the largest Indigenous population here. And so it might not be as robust as places like New Mexico or Minnesota, but hopefully moving forward, we'll be able to develop those connections. Two things I did notice though. So first of all, that faculty member that I mentioned over at the Children's Hospital, they don't really have like a systematic way of doing this, but she actually already provides occasional like lunch talks to students, specifically doing her rotations within her department. And they learn about like the IHS clinics, not in Ohio because we don't have any, but in the future, if they ever rotate out with other sites or work in other states, they'll have that knowledge. And so potentially growing things like that. The other thing is we do have a 4th-year elective rotation that you can go over to New Mexico and work at an IHS clinic over there for a little bit of time. But in asking other people about that, they knew nothing. And so I feel just like increasing everyone's awareness of these programs as well, because there are resources out there. We just need to know how to access them. And if we don't, then it's almost as if they don't exist in the first place. And so I guess my biggest takeaway from this is just letting people know that we exist, we're present on their campus, and that we want to help, and putting the resources in place for allowing us to help as students, but also for the faculty to do their part as well.
Just a quick follow-up question. Thank you for that. Do you feel like DEI in general, from your experience, like the DEI resources are monolithic in that they kind of are just talking about diversity in and of itself, and maybe other ethnicities, races, affiliations are represented a little better, and that the native resources in and of themselves are especially lacking? Or is it as a whole with DEI?
So again, preferencing, I can't speak today, saying that this is all just in mind of like my own school, but I definitely feel that's the case. It really reflects kind of the diversity of Cincinnati, because it is a very diverse place, but there is hardly any emphasis whatsoever placed on Indigenous students here at University of Cincinnati.
Thanks for that. So our next question is from Morgan. How, if at all, do you balance the tenets of the Western or European model of medicine with the traditional practices inherent to your native heritage? If you have an example of a situation where cultural knowledge positively influenced patient care, that would be awesome. And if you could speak maybe on the importance of doing so, and why, for you personally, integrating culture with Western scientific medicine is going to lead to better patient outcomes.
Yeah, definitely. I think to start off, it's important to say that I kind of naively came into medical school thinking that we could indigenize Western medicine. And I've kind of slowly come to realize over my 3 years in medical school that that's just a really big task to take on right now. And the westernized medical system is not designed inherently for Native people. And it's a huge paternalistic society. And so I feel for me, it's important really just to focus on what I can do as an individual and then surrounding myself with communities that are trying to make positive changes in westernized medicine. I think it's great that we have Shaelyn on board and can kind of speak to the new programs going on in Cherokee Nation, because that's like a perfect example of like having indigenous knowledge, inform the way that we actually go about teaching medical students and that kind of systems-based work. I guess an example of where I have been able to incorporate, cultural knowledge into patient care. I would probably highlight an example. Prior to medical school, actually, I worked as a psychiatric technician for the state of South Dakota in a long-term inpatient psychiatric rehabilitation center. And so our patients were there often for years, months at a time. And they really didn't have great access to spiritual health or elders, medicine men, that kind of thing. And so one thing that I was kind of able to take on during my time there was putting together something called smudging kits. And so pretty much we would just contract with local indigenous families, and they would bring in cedar, sweetgrass, sage, or any other medicine requests that our patients had. And whenever I would work on the evening, we would bring out the kit and be able to provide smudging for them in a controlled environment as much as you can in a psychiatric hospital. But it was really like a firsthand experience of seeing how this very small act of spiritual healthcare really improved patient stays in the hospital, and gave them something other than a medication to try as far as, wellness. And so that's kind of my residency goal, is once I'm more established in a medical society. Right now I'm kind of rotating through a bunch of different hospitals and there's not really enough time to kind of establish programs like that. But that's something that I'd like to do more so in residency, is kind of have those accesses to traditional medicine within the westernized healthcare system. I think that's a great place to start.
Thank you. What a cool experience to have to take into medical school with you. That's really, really interesting. So those are most of my questions for singling people out. The last question I have before we get to the questions in the chat, and I know there are a bunch of them, we'll get to those. Timing is actually going really well for this. So my last question, and anybody is welcome to answer it, all or just a couple of you. Can you share a personal achievement or success that highlights the strengths and contributions of Native American medical students? And how can the broader medical community recognize and celebrate these accomplishments by Native American healthcare professionals better? And like Michael was talking about, get some of that acknowledgement out into the world. I won't call on anybody, I promise. You can just decide who wants to go first.
I can't remember who said they were on the AMA, MSS, CAIA committee. Was it Morgan? Are you also on the AMA committee? Maybe it was Tatyana. No, maybe no one was. Well,
I am.
Oh, no, it's you. Okay. I was like, I know someone else. I'll have him talk about that. But I was on that last year, and I think that's a big thing in the community that medical students specifically can do through the AAMC. It's mostly policy kinds of things, but people are very passionate about that, and I think that is a great resource. I think another thing that I've participated in, I guess specifically, is the T35 campaign is something that I was able to do between first and second year. And it was specifically for Native American medical students that wanted mentorship and to form a project, really. And then we could present our project at a conference. So I got I was paired with a mentor from Cleveland Clinic, and we kind of over 3 to 6 months developed a poster on alcohol use disorder. And it was she actually has a lab out there in Cleveland Clinic, and I wasn't able to go out there, but Dr. Nagy was able to help me with formulating a poster for the oh my gosh, I went to Seattle for it. But I think T35 is something that I wasn't really aware of before medical school. And I think it's a great opportunity for Native students to get involved in research.
One success or achievement that I'd like to highlight, maybe especially kind of in the context, seems like some panelists haven't had super great experiences with like an Indigenous cohort at their institution. I think that the University of Minnesota has a really great Indigenous geared focus, and I felt very supported and celebrated during my time as a student. And so just kind of highlighting some of their programs at Duluth specifically, and now there's an office in the Twin Cities too, but the Center for American Indian and Minority Health is just like, I don't know how to explain it. It's just a great center for all underrepresented students just to have a place to land. They provide like snacks to us during our first 2 years, and like resources for studying, cultural connection events. And yeah, now they have a program similarly in the Twin Cities. And so I feel like just the University of Minnesota is working on getting it right, and they have other things going on. There's the Memory Keepers is a really cool research cohort that's working on like aging initiatives in Indigenous communities and rural populations as well. So really cool research